spread of Omicron and what you need to know about the days ahead. Joining our medical panel this morning, Professor of Infectious Diseases at the University of California, San Francisco, Dr. Peter Chin-Hong in San Francisco, the Executive Director of the Piedmont Health COVID Task Force, Dr. Jane Morgan in Atlanta, where we are, the Director of the University of Kansas Medical Center of Infection Prevention, Dr. Dana Hawkinson in Kansas City, Kansas, and finally, Professor of Public Health at Yale School of Public Health, Dr. Albert Coe, who's probably dealing with some snow issues right now in New Haven, Connecticut.
Yeah, welcome everyone, and thank you so much for all of you joining us in this discussion. And Dr. Morgan, I want you to kick us off. How is Omicron looking in your part of the country?
And so when we look here in the South region, and thank you very much for having me today, we absolutely see what we're seeing in the rest of the country, that we're seeing this astronomical rise. We're also having challenges with staffing shortages and actually are having to make decisions as we did with the ancestral strain, that are initial virus coming out of Wuhan, regarding what we're going to do with our elective procedures as we see our emergency rooms being overrun, the hospitalizations of children increasing. In fact, over the past 2 weeks, we've had a 4- to 5-fold increase in pediatric admissions, and challenge with staffing shortages as well, as Omicron is affecting not only the public, but healthcare workers as well.
Let's go to the opposite coast. Dr. Chin-Hong with the latest on your coast. What are you seeing?
So a very similar picture. We've had more than a 4 times increase in cases in California in many regions. We are seeing not only just influx of patients coming into the hospitals, but like on other parts of the country, staff being called out because they're ill. And this is not just nurses and doctors, they're also technicians, laboratory staff. So all facets of the healthcare system are being affected. We're thinking about pausing surgeries, elective admissions now. So it's kind of reaching critical level for more than 50% of hospitals in the West Coast.
So, Dr. Hawkinson, I want to go to you now in Kansas City, Kansas. When we're talking about testing, we've seen those long lines. I mean, people waiting hours and hours for testing. Or, Dave and I, we've tried to find tests in Atlanta and haven't been able to find it. So what are some challenges that you're dealing with when it comes to testing in particular?
It's all the above that we've heard. It is staff shortages, the ability to have people to actually do the tests. It is also test supplies. You know, these shortages are far-reaching as far as the human workforce, but also supplies. We continue to have a shortage on supplies as well. We have never really had a problem with capacity and the ability to test people. You know, over the past couple weeks, we have run into that where our people that are doing the tests are working more than 100% capacity to be able to get those people in and tested. That has never been a problem before during this pandemic because we've had a good amount of staff, we've had a good amount of tests, we have been able to run a lot of tests. But right now what we're seeing is that we are running over capacity in the ability to do those tests. And there are shortages of the people that are doing them. There are shortages of some of the test supplies as well.
Just about every state in the country is essentially a hotspot right now. Connecticut has certainly been a surprise. Dr. Coe, what's the latest there in New Haven, Yale, and throughout the state of Connecticut? And really, if you can characterize the entire Northeast.
Yeah, so you know, we are much like our other speakers have mentioned. In our wave or a major surge, we have had rapidly increasing increases in cases. Hospitalization levels are greater than the peak of our second wave last year during the winter period, and reaching levels that we encountered during our first really devastating wave back in March and April of 2020. So much of the Northeast is looking at broad, widespread community transmission. That, is fueling the hospitalizations and increasing hospitalizations with, as mentioned in many other parts of the United States, stresses to our already fragile healthcare system.
I want to talk about kids now with you, Dr. Morgan. You mentioned that hospitalizations have increased 4- to 5-fold in pediatric admissions. And that's the story that we've seen across the country as well. But when it comes to schools, we know that it depends state by state, district by district, community by community. Do you think that in Atlanta, school reopening for full capacity on Monday, do you think that that's too soon, or is that the right thing to do?
I think that's a great question, Alex, and it really is going to depend on individual situations. And so, does your school have the capacity for excellent ventilation? Are they requiring their staff, not just the teachers, but all the other staff in the hospital, to be fully vaccinated and masked? Are these children coming from households that are fully vaccinated? And so depending on what your school and school system and that culture is, really will depend on the safety and the comfort level at which you can return your children to school. Obviously, as parents, we all want to do the best that we can for our children and make the absolute best decisions. And so these are going to be individual decisions, not just here in Atlanta, but everywhere throughout this country, regarding whether or not you feel comfortable that your school is a safe place, and also balancing that with the mental and emotional health that we see is required for children for socialization. As we have noted time and time again, this regressive behavior that we see in children younger than their stated age, probably because of this pandemic.
Yeah, schools closed in Chicago, one of the nation's biggest districts. Schools open in New York City. The new mayor, Eric Adams, has been adamant about keeping them open. Let's go again to the West Coast. Dr. Chin Hong, are you seeing an increase in pediatric cases, hospitalizations? How concerned are you? And your recommendation about schools?
So we are looking at the East Coast, we're looking at Chicago area, and we're fearful of an increase in pediatric hospitalizations. Luckily, we haven't seen so much of an increase right now in the West Coast. It's really been concentrated in the adults. Nevertheless, there's a lot of anxiety in parents. Testing is really the heart of that anxiety and feeling safe from the teacher's perspective. But we are seeing those pediatric hospitalizations tick up, but though not dramatically as in numbers as in the East Coast and other parts of the country.
Dr. Hawkinson, throughout this entire pandemic, we've seen a lot of vaccine hesitancy, whether that's the initial doses or even the booster shot as well. And I was doing some research, and I saw that less than 60% of your state have gotten their first shot. Is there a vaccine hesitancy that you're seeing there? Is it just about, lack of education as far as what these vaccines mean?
Yeah, absolutely, 100%. It's a combination of different factors. It's hesitation because of fear. You don't know what the vaccine will bring you as far as short-term or long-term possibilities. Obviously, we know the immense safety of these vaccines compared to any risks that are there. There's also continues to be a fully guided misinformation campaign that goes on for one reason or another, whether it's social media or friends or family. But what we have continued to see, just as you pointed out, is that a majority of these hospitalizations, certainly here and I believe all across the United States, continue to be in those unvaccinated populations. So yes, it continues to be hesitancy for many reasons. Some of them are true and honest. Again, the fears. But we continue to encourage and endorse the message of vaccination and try to get out all of the important information rather than the misinformation that continues to be out there. And so it is very difficult. It is sad. It's sad because right now in our hospital, over 90% of the hospitalizations are in those people that are unvaccinated. And so much of this could have been prevented with vaccination and booster.
So 90% of hospitalizations unvaccinated. And I'm curious what you're seeing there, Dr. Koh at Yale, in terms of the number of hospitalizations related to vaccinations. And do you think the messaging should change around vaccinations? Because clearly people who are triple vaxxed are still getting it. Should it just be that this is your way to stay out of the hospital and to stay alive, not that you won't get it? And the Supreme Court is also expected to weigh in on this in terms of the mandate. How effective have those policies been?
Yeah, so I think there are three questions. I think the first question, just, our situation resonates with those across the country. COVID is still a pandemic of the unvaccinated. Our hospital, the majority of our cases that are being hospitalized, that are dying of COVID, are among our unvaccinated populations. To their second question is, how well do these vaccines, really the heart of the issue is how well do these vaccines work? So what we do know is that these vaccines, having a primary vaccination with 2 doses of like Moderna or Pfizer, gives low levels of protection against infection, being infected, or getting mild disease. So this vaccine is not what we're going to have. It's not going to be the home run like measles, mumps, or rubella, which it gives a these are transmission blocking vaccines. But what these vaccines do, and whether you get a primary dose and even increase when you get a booster, is that it prevents the hospitalizations, the severe complications of COVID, hospitalizations and deaths. And that's really why it's important. The major goal here during the pandemic is saving lives. And that's why these vaccines are so effective in saving lives.
All right, we're going to stop right here momentarily and take a quick break before returning to you guys. So hang tight. We'll be right back after this.